Thank you so much for being here today, especially to Mayor Hubbard that's here. Appreciate that. And City Manager Sharon Subadan. So thank you so much for your time this morning. And we've got many others to recognize here today. We've got obviously our incredible employees. I see a number of our physicians. We've got administrators. I see Kim here. We got Brandy, Joe, and then we've got our incredible volunteer board members here. And so I'd just ask if our board members could stand up. That'd be great, just to everybody can see the support that we have. Yeah. You know, we've got one of the benefits of being the president and CEO here at Phoebe Putney is our volunteer boards, and we've got a lot of them. But they do some incredible things and are so supportive of the mission and the work that's done all across our system, all to benefit the people of Southwest Georgia. So I am eternally grateful for that support. Today we're excited to announce an investment of $250 million over the next 5 years in new facilities, new services, and new members of the Phoebe family. This is truly an investment in the health of our communities. I have been part of the Phoebe family for 6 months now, and I'm proud to be part of an organization that is such an integral part of the communities that we all serve. I promise to spend my first 6 months in Southwest Georgia listening to our physicians, our board members, our employees, patients, community leaders, elected officials, hospital leaders, and healthcare industry colleagues. More than 500 meetings have occurred. It's a couple. And thank you to Felicia, by the way, my great assistant who made those 500 possible. Not an easy task. And I continue to be amazed by the compassionate care that is provided each and every day throughout our health system by some amazing healers. This is not to say that we don't have opportunities to improve and to build new models of care. I want to share some details with you about an initiative called Phoebe Focus, if you didn't notice the banner. This new strategy and new philosophy will focus on our future by building on Phoebe's successes and our 108-year legacy of community service. It will set a new course to guide our entire health system over the next 5 years as we focus on our 5 strategic pillars of quality and patient safety, growth, people, service, and financial excellence. Patients ask 3 things of us: to keep them safe, to heal them, and to be nice to them. The foundation of all we do must be patient safety, and that's why our first strategic pillar is quality and patient safety. Before I came to Albany, Phoebe committed itself to patient safety. Work groups began focusing on specific areas, and in the last 3 years, our teams have reduced incidents of patient harm by an amazing 61% throughout our healthcare system. And I don't know if you all realize how incredible that is. I've told the team that should be written up as a white paper, and because it's almost unheard of to have that great of improvement over a short time. So let's just give that care team a round of applause. We are committed to building on that success through a journey to become a high reliability organization, or an HRO. An HRO is an organization that operates in a highly complex, elevated risk environment and truly embraces a deliberate and structured approach to safety. They commit to a goal of 0 accidents and 0 harm. Those of us who work in healthcare owe it to our patients to make that commitment. One study has shown that more than 250,000 people die in hospitals each year because of preventable harm. That is unacceptable. At Phoebe, we are and will continue to be obsessed with failure and with correcting processes to prevent patient harm. That's why we recently partnered with Healthcare Performance Improvement, or HPI, a national leader in building and sustaining cultures of safety in healthcare organizations. HPI will help us map our HRO journey. Our goal is zero patient harm. Patient safety will be at the core of our culture, and we will focus on team member and physician safety as well. And we will finally establish a Care for the Caregiver program, which is an integral part of any safety program. To provide patients with the safest environment and highest quality service, we also must have the best facilities. That brings us to our strategic pillar of growth and our plans for that $250 million capital investment over the next 5 years. We have been working with independent experts for 2 months to create a comprehensive strategic plan for our entire health system. They've conducted interviews with more than 100 community leaders, patients, physicians, employees, and board members. They continue to analyze regional healthcare data and industry trends. The strategic plan is not yet finalized, but we have identified 6 key areas of investment. First, we commit to providing private patient rooms for all patients in all of our hospitals. We simply cannot offer the level of service and safety and privacy patients expect and deserve without private rooms, and we will make this a reality. Second, we will transform emergency care in our region. We will do this through a new and expanded emergency center at our main Albany hospital that will improve service and reduce patient wait times. We will be collaborating with our emergency center team and physicians to ensure that we get this right. We will also be putting together community focus groups to hear what patients want and need in a new emergency center. If you're interested in participating in one of those focus groups, you can sign up at phoebefocus.com. As previously announced, we are currently in the process of seeking Level 2 State Trauma Center designation at Phoebe Putney Memorial Hospital. The expansions and improvements that come with this trauma center designation will truly save lives. We will also be looking at the opportunity to go to a Level 3 trauma center at Phoebe Sumter, as well as enhancements at Phoebe Worth. Third, we will greatly impact our ambulatory care network. We plan to open a minimum of 5 new outpatient centers throughout our service areas. This will expand our community care and urgent care model to reduce emergency room congestion and provide more affordable care to more patients in the appropriate setting. These centers will improve access to primary and specialty care for people in Doherty, Lee, Worth, Sumter, and surrounding communities. This is the evolution of healthcare, and we will continue to offer low-cost options such as these. We'll take care outside of the walls of the hospital, and we'll provide more care to people where they live and work and play. Fourth, we will improve our neonatal intensive care unit and our women's and children's services. Our NICU is amazing and is the state's regional perinatal center for 22 counties in Southwest Georgia. It is filled with some of the most compassionate and committed caregivers you could ever hope to meet. We will renovate and expand our NICU space and services to create a state-of-the-art facility to care for our smallest and most vulnerable patients. The NICU will just be one part of our overall expansion of women's and children's services. We are also committed to improving access to pediatric specialty care for families throughout the region. We are just now preparing to open our renovated mother-baby unit, and we will build on our OB hospitalist program, which is unique in our region, to create the most integrated perinatal center in Southwest Georgia. We will also work to enhance our OBGYN provider services across our healthcare system. Our fifth key investment will be an expansion of our clinical services at Phoebe North. We will give greater focus to the services we are providing, we will give greater focus to the services we provide by creating a post-acute transitional care campus. Care for the patient doesn't stop when they are ready to be discharged from an acute care hospital. We are committed to providing a continuum of care. Services we are considering include expanded rehabilitation services, behavioral health care, including outpatient, which are we of course all know are desperately needed in our community. And we will be looking to partner to offer long-term and transitional care models, all at Phoebe North. The sixth area of investment will be in our operating suites. This fiscal year, we are beginning major renovations to our operating suites at our main campus, and over the next 5 years, all of our operating suites will be updated to meet the needs of our surgeons, anesthesiologists, and staff, elevating care delivery to ensure the best outcomes for our patients. We still have a lot of work to do on these plans I've shared with you. Our strategic planning process continues, and we anticipate identifying other areas of opportunity to serve our communities. We will continue to gather input, and we'll be working to put out specific plans. So investment in these facilities is needed and a key strategy, but our most important asset is our people. The Phoebe family is truly inspiring, and we are investing to make sure our family and future is even better. In our 2020 budget that we started just 26 days ago, we have included funding for more than 200 new jobs at a Phoebe's facility or care site. That's an increase in our workforce of almost 5% and a payroll increase of more than $10 million, a huge boost to our region's economy. Our health system already has nearly a $1.3 billion annual impact, and we will continue to be one of the largest economic engines for this entire part of Georgia. We also budgeted for a 3% overall increase, pay raise, and market adjustments for all employees, and that's an investment of $4.6 million. We put aside $1 million for tuition assistance and student loan forgiveness for the Phoebe family, and we're investing $3 million to build a state-of-the-art simulation lab to provide cutting-edge training and education for our teams. These investments are good for our people, but they're also the right thing to do and will help keep our patients safe and will improve care. One of our primary goals with Phoebe Focus is to improve our strategic pillar of service. We want to provide the best facilities and most advanced technology, but that doesn't mean much if our service we provide doesn't match. We live by the golden rule to treat others as we would want to be treated ourselves. And we will do just that with our words, our actions, and ultimately our care. We are also in the process of creating a new mobile app that will make it easier for our patients to schedule appointments, check out your medical records, and to meet providers. We are also looking to increase and expand our many important community partnerships. One example is a new one with Flint River Fresh to plant a community garden on Phoebe property that will provide fresh produce for people who don't have easy access to healthy food. We will also be reevaluating our mission, vision, and values to ensure they truly reflect what Phoebe is about and the commitment to our communities. We are only able to make these investments because of our focus on our fifth strategic pillar, financial excellence. Phoebe has a long history of fiscal responsibility and a commitment to reinvest 100% of our earnings back into our facilities, our team members, and our communities. Despite unprecedented financial challenges in the healthcare industry in recent years, Phoebe board members and leaders have managed our resources incredibly well. And that's what allows us to make the commitments that we have outlined today. We have a number of Phoebe board members, as I mentioned here today, and that only continues to show the support that we have. In closing, I invite you to visit a new website, phoebefocus.com, to learn more about our plans to keep up with the progress. We will also have links at phoebehealth.com. They really talk to each other, so if you don't remember that, just go to phoebehealth.com. We will continue to share information with all the members of our community, as well as what our plans are as we develop them. Over the next month, we will have employee forums where Phoebe family members, physicians, and volunteers will have a chance to ask questions and to give input. I invite our friends in the media to join me in our boardroom now, where you can ask questions that you may have. I do appreciate everyone's time today. I know this was a bit short, but I think it's such an exciting time for Phoebe. I'm privileged to be part of you, to be part of the Phoebe family, and to be able to lead this great organization. So I thank you for your time, and I hope everybody has a wonderful day. Thank you.